Thank you for joining us. This is Health Your Own Way podcast, and I am your host, Mo Atkins. Welcome to another episode. Today, we're going to be talking about menstrual cycle and the importance of tracking. I'm really glad to have this conversation because we really have it, especially as women. At the same time, before I go further, let me introduce my guest. My guest is Ali. She's a co-founder of PMDD Collective, psychotherapist, yoga therapist, and registered mental health nurse. And my second guest is Emily. She's a co-founder of PMDD Collective. She's a psychotherapist and a counselor. Before we move further, anything else you want to add, ladies? Or can I call you ladies? You guys have a pronoun? Or?
Yeah.
Okay, perfect.
Yeah, no, ladies is fine. Just thanks for having us back. It was a blast last time. So yeah, looking forward to it.
I don't know if it was a blast. It was very disappointing. I left upset. I'm telling you, I'm not going to go there, but I left upset for almost like a good 2 days. And I was talking about it, but for another time. All right. So as I was mentioning, today we're talking about menstrual cycle and the importance of tracking. First of all, I know I say no question stupid, but what is menstrual cycle? Like a lot of people experience it, but don't really understand what it is. So high level, how would you describe a menstrual cycle? Menstrual cycle. Yeah.
So, I mean, your menstrual cycle is your period. That's what what most people say their period, and it is the point from which you get your period is day one of your menstrual cycle, and it goes up between 20 and 40 days is your kind of average cycle, and it is the natural kind of hormonal fluctuations within that. So the rises of your progesterone and estrogen, where your body is preparing for pregnancy, because every month a menstruator, and we say menstruators rather than women, because not all menstruators are women. People who are assigned female at birth may well still menstruate. So you will start with day one, where you'll have a bleed, where your cervix is getting rid of everything, and then the next stages are all there's 4 phases, and we'll talk about them. And then it's that from day one of your period to day one of your period again, I guess. And it's really natural, it's really normal, and it is what our bodies do, because we are built, we're not meant to, not as a human, it's not our duty, but we are built to reproduce, to have these babies. And so our bodies every month go, all right, let's do this. Oh no, let's not do this. Here's your period.
And I love you. I love you when you described that. Was great. And I know when I like the fact that you explained that, because I don't remember anybody even saying that to me. Like I may have gone to high school, maybe let's say high school, because I don't think they teach that in elementary. But I think it was very vague. I don't think they go into details. Like a lot of us women, we wake up one day and we have our period, and then mommy or daddy's like, yeah, take a pad and that's it. I don't think anybody sits there and tells you the cycle and the importance of it. So now we have an understand the idea of it. Now you mentioned earlier that there's 4 phases to it, right? I need to know 4 phases, because at my age, and I'm a grown ass woman, I don't know the 4 phases. I'm being serious. I don't know the 4 phases, and I wasn't taught the 4 phases. So please educate me.
Yeah. Yeah, sure. So yeah, the 4 phases. There's menstruation, the one that everyone's heard of. That's your period. That's when you bleed. Straight after that, there's the follicular phase, and then ovulation, which is the other popular one that people might have heard of.
Yeah,
and then in between ovulation and your period is the luteal phase. So we'll go into a little bit of what's going on in your body in each of those sort of phases. So for menstruation, obviously we're all the blood and the tissue that has been produced and lined the womb is now being ejected through lovely way of putting it, through the cervix and out through your vagina. So period can last sort of 3 to 7 days, and that can vary month to month, and you can learn quite a lot about your menstrual health through what your blood is like, actually. So yeah, even just getting to know that bit a little bit more can be quite helpful. And so once that'll take you up to between day 3 and day 7. So once that's finishing, you're into your follicular phase. And well, there's kind of an overlap, isn't there? So your follicular includes the menstruation part, and your luteal includes the little ovulation part. Probably a diagram would have been good, but anyway, we're on a podcast. So yeah, your follicular phase goes from your menstruation to your ovulation, and in this part is where we're kind of gearing up for another round of, are we going to have a baby or not? So your hypothalamus is telling your pituitary gland to release the follicle stimulating hormone, which is what they'll test for, you know, if you're ever having a blood test. And I think, is that also, no, it isn't. Is it what they test for with pregnancy tests? Is that the same hormone? I think it might be.
Or is it the luteinizing hormone?
Oh, it might be the luteinizing one. Might be getting them mixed up. Anyway, so essentially, that produces follicles. Each follicle houses a sort of egg, an egg that's not quite ready, and they produce estrogen, which then helps to thicken the lining of the womb and get it all ready, essentially, for if there is going to be a fertilized egg. So normally only one follicle will keep growing, and the rest are kind of reabsorbed into the body and sort of recycled. So that will happen around day 10. And then that takes us into the ovulation phase. So that's where the egg is released from the ovary and it goes down through the fallopian tube. And the egg will then sit for, will begin its 5-day kind of travel through the fallopian tube and get to the uterus. And if there's sorry, I'm losing where I'm at with this. So yeah, so the egg then will travel down the fallopian tube. Halfway through that cycle, and that's that 28-day cycle, so that would be around kind of day 14, and there's a sudden surge in the luteinizing hormone that causes the ovary to release the egg. So when that happens, the progesterone then starts rising and helps again to prepare you for pregnancy. And that's when you might notice the sort of physical symptoms coming in. So changes in the cervical mucus. So lots of people notice like it's like an egg yolky kind of mucus. You might get sort of tender breasts. Some people get ovulation pain as well. And it can make you have an increased interest in sex as well. So if you're hoping to kind of conceive, then the egg can be fertilized around this sort of time.
Repeat that time so I know not to. So just repeat that time so I know not to.
Yeah. I guess it works both ways. And then, so after that then takes us into the luteal phase. So if the luteinizing and follicle stimulating hormones we've learned about earlier are now sort of decreasing, and the follicle that house the egg closes, and that will release progesterone and some estrogen, which are then again thickening the womb lining, and preparing for the fertilized egg, or preparing for the next cycle. So yeah, kind of depending on whether it's fertilized or not will depend on what kind of happens there. But yeah, so people with a short luteal phase might have trouble getting pregnant, or a longer luteal phase could indicate things like PCOS. So you can tell quite a lot just from understanding like the length of those phases that actually we don't really hear about that much. And so the progesterone really will peak halfway through, and then drop, and that's kind of what causes a lot of the premenstrual symptoms, and that we might notice during sort of having PMS, or for people with PMDD more severely, so like the mood changes and headaches and things like that. Oh, that was long going through that.
So I'm going to say a few things on a personal level that was very, very disarming and alarming for me, because I say this is because you go so many years not knowing how your body works. And then when you picture, you're just like, okay, all right, this is how it makes, like, it's like understanding, okay, by the 14, 15 day, this is what is happening to your body. This is where you should be. And for a lot of people don't know, they can't relate to, why am I this way? Why am I pain? Like, they don't understand that. And by the 28th day, it's more like, okay, this is what's happening. I think overall, just having some form of high level understanding of how your body functions can help you long term anywhere in your life. Also, the fact that now I have a visual representation in my mind of what each process looks like, I'm just like, okay, thanks, ladies. Thank you, thank you for that. But on a real, I think for a lot of people, they're like, okay, so you've given us a lot of information, but why is it important to know that information?
So I mean, like Ali mentioned, there are things that you can spot. If you track your cycle, you can spot, the length of your follicular phase, the length of your luteal phase. That there are things that can be found out from that. Things like polycystic ovaries syndrome. So if you've got an elongated follicular or luteal, I can't remember, one of the two.
Luteal.
Your luteal is long, then it's there's a chance that you've got polycystic ovaries, because your ovaries, when they're getting up into that follicular stimulating and luteinizing hormones, things are not going quite as they should be, and your periods aren't coming. It can inform you about your fertility, and not just in the sense of when you're fertile, but if you have a long follicular phase, then that may mean that you may have a difficulty getting pregnant, because your things are not going fast enough. It's not happening as it should do. Also, for things like endometriosis, I mean, so many women experience endometriosis and are dismissed by healthcare providers. Oh, it's just pain. Everyone experiences pain, which is an absolute nonsense. No pain is normal pain. Like there's no, it's not okay to feel pain. It's a sign that something's wrong. But if you're tracking your cycle and you have endometriosis, you're much better able to go to your doctor and say, look, this pain is specifically at this point. This is what's going on. You need to take action. Because that's something that we don't really realize as healthcare users, and especially as women, or assigned female at birth. In my experience is that we go in and they go no, and you go, oh, okay, sorry, I made a fuss, sorry. Whereas if you go in armed with information, you're in a situation where these people who work in a factual, evidence-based way, okay, all right, we can't really argue with this. You have tracked your cycle, you can show me these things. Which is, I mean, with our other podcast, we talked about premenstrual dysphoric disorder, and that is the first step to getting a diagnosis of that, is to track your period, because it helps you understand what's going on with your moods. It helps you know that you are, on day 25, almost every month you decide you're going to quit your job. On day 14, you get a real burst of energy and you clean your house every month. Like, these things, you can start to spot yourself and know yourself and prepare for stuff. If you know you're always going to quit your job, then you can go into, I work from home today. What am I going to do? I'm not going to go into a big board meeting with my CEO. So it helps you to just know you, because fundamentally we deserve to know who we are. And it is a huge part of who we are. Our endocrine system impacts a huge amount of our life. And we're entitled to know that. And tracking your cycle allows you to do that, which I think is kind of kick-ass. You're like, take ownership of ourselves.
I agree with you. And I think what was really that stood out for me was when you said advocate for yourself. When you go to doctors and stuff like that, I find a lot, when you mentioned, oh, I don't want to make a fuss, like on a personal level, I remember going to a doctor and I was like, this is not right. I know what my body should look like or feel. This is not right. And I remember it was actually a woman. She was dismissive at first. And then I was just like, and then she looked and I showed her pictures like, this is not right. This is not what my body should. And she's like, okay. And she apologized. And then she referred me to a specialist, and the specialist realized, well, and then they fixed it. So I think understanding, especially your menstrual cycle, if you know what is going on, you can advocate for yourself. If there's something that seems a little off than what happened a month ago or 2 months ago, and you're like, okay, something's different that you've been tracking, like, so I think the biggest thing for me so far, what I'm hearing from you, is advocating. And you can only advocate for yourself if you can know for sure that this is how my body normally works, or it's not working the right way, is what I understand so far.
Absolutely. And I think in that there's the kind of knowing yourself and knowing that something's not right. So, you can go, well, my periods are completely irregular and I can prove it. Especially, I remember being a teenager, and did I have any clue when my period was coming? No. People around me might have been able to spot it, like additional teenage rage. But, I didn't know, and I didn't even think to track my cycle. I had no thoughts about that. The only things that you kind of get told about when it comes to your cycle is if you want to have a baby. You only need to pay attention to your periods and your cycle if you want to have a baby, because when you're going to ovulate. Mm. And that's just a nonsense, because it impacts so much of your life. It impacts your energy. If you're into sport and fitness, you may well find that in your luteal phase, you are tireder, your personal bests are just impossible. You're exhausted, you can't lift something. You just don't want to go and do that because your energy levels are down, because your body's doing a whole bunch of stuff. You've got these tiny little cells going, let's line the uterus, we're going to cover it in blood, make it all nice and cozy like a bed. You have different energy levels, and that kind of stuff. Being aware of that means that you can adjust your life around it. And the thing about doctors as well is that we work with a lot of clients who have gone to doctors and said, this is happening. I'm in pain, or I'm getting these mood things, and they minimize and they dismiss. They say, oh, all women get, mood issues, or all women feel pain. Or I have clients that doctors said, when they've gone at, as a young woman with excruciating agony, being dismissed and said, oh, well, come back to us when you want to have a baby and we'll think about it. Because that's what we're taught. We're taught that our menstrual cycle is purely related to whether or not we want to make children.
Honestly, up until like maybe before talking to you guys in general, that was my concept. Like, I'm not trying to be, I may sound ignorant, and really it is what you mentioned, cycle. Like, okay, you have a period, you're not pregnant. You have a period, you're not having kids. And that's all I know, because that's what I grew up with. Nobody else mentioned anything else that affected your mental state, your energy level, nothing like that. Maybe PMS was the only thing. And then PMS, you just based on the stigma against that, as well as just having a kid or not having a kid, is the only thing I was taught. Now, I guess the thing is that if anybody was interested in learning more about, tracking a period, or just learning more about what you guys offer or do, what's the best platform to reach you guys out on?
So yeah, we're mostly Instagram. I think we might have said in the last but
podcast, this could be the first time somebody was talking to you.
We are terrible with Facebook, so we try. So we are there, but the best place to reach us is on Instagram. Okay. We do have our own website as well that you can check out. Yeah,
I'll have it in show notes, but just for people that are listening, what is your Instagram handle and your website?
Oh yeah, sorry. So okay. It's the PMDD Collective.
Okay. I want to say I sincerely enjoyed the 2 conversations I had with you guys. Like, I've learned a lot. You've depressed me in good ways and bad ways. No, you think I'm joking? No, you have. Like, I'm not like anybody. If this is the first time you're watching this, you gotta watch the second one. You'd be upset. Watch the first one before you'd be upset, because I was upset. But moving on, and I want to say, I appreciate this conversation. I appreciate what you guys do, because as a woman at my age, it's a shame that I'm learning this at this time. And I'm hoping that women younger than me are learning it young, like in their as early as 10 or 11, because I got my period at age 11. So if it's taking me, I'm going to age myself right now, 29 years to learn this. It shows how me, myself, or society has failed me in educating me in my profession, in my own personal self. Okay, anything else you guys want to add before I get more depressed and sound more depressed?
Maybe just that it's it's so much easier to track your cycle now. Like there's so many different apps and things that you can use to help you track your cycle that will give you a good idea of when your ovulation is. And that's a good place to start, because you know, you might then tune in and notice these things like oh yeah, I do get on a little ovulation twinge, or yeah, my boobs do feel sore around this time. So it's a really good place to start. There's lots of apps out there. There's Clue, there's Flow. Yeah, there's plenty. So just track your cycle, basically.
Yeah, and some people prefer to do it in a written way. You know, some people don't like an online app, and that's, you know, super easy as well. You can keep a journal. If you've got a diary where you put your appointments, you can just put a simple thing in there. You can have it, you know, a color scheme. You know, red is a good, you know, red is not a good day. Why would I pick that? Red is a bad day. You know, amber's that you're feeling all right, green is great. So even just something as simple as that you can just keep an eye and you can work it out.
I appreciate it. No, I understand. And I think anybody's watching or listening, like reach out to them, or just, as she mentioned earlier, there's apps that help you out. I think it's beneficial long-term for you, and understanding who you are and advocating yourself is what you need to be able to keep yourself healthy. So thank you, ladies. I appreciate this conversation.
Thanks.
Pleasure. Thanks for having us again.
We're glad to have you join us. Don't forget to subscribe, leave a comment, share with anyone that needs to be empowered and inspired, and don't forget to join us next week for the next episode of Health Your Way podcast. Have a good day, you guys.